24 million people have it, 6 million people don't know they have it, and 57 more million people in the United States are about to get it. It is the leading cause of heart disease, stroke, kidney failure, blindness, and amputations. It is the seventh cause of death among adults in the United States. Ladies and gentlemen, this is caused by a debilitating disease called diabetes. Through my clinical experience as a nurse, I have cared for and helped many diabetic patients on a daily basis. I help patients manage this deadly disease through medication and education to change their lifestyle. I also took care of my family members who are diabetics. There are approximately 24 million people in the US. You either know or will know someone with this disease. That is why it is imperative that you are knowledgeable about diabetes. It is for this reason that this speech aims to provide answers to the questions such as what is diabetes? Who are at risk of having it? Is it preventable? If so, how? What are the complications related to diabetes and how can we avoid them? How can it be managed? Diabetes is a disease which the body lacks insulin or the decreased ability to use insulin. Insulin is a hormone that allows glucose, or commonly known as sugar, to enter cells, to be converted to energy. When diabetes is not controlled or treated, the glucose and fats remains in the blood, and over time it will damage vital organs that will eventually lead to death. I will discuss the two most common types of diabetes, type 1 and type 2. Type 1 diabetes can occur in any age. However, it commonly develops among children and young adults. No wonder it is sometimes referred to as juvenile diabetes. In type 1 diabetes, beta cells fails to produce adequate amounts of insulin, and as a result, insulin injection must be taken daily. Hence, it is also called insulin-dependent diabetes mellitus. Type 1 diabetes may be autoimmune, genetic, and/or environmental toxin-caused disease. Currently, there is no known way to prevent this type of diabetes. Type 2 diabetes is also called as non-insulin dependent diabetes, and it accounts for 90 to 95% of diabetes cases. This type of disease generally occurs during middle age and is associated with obesity and inactive lifestyle, race, ethnicity, and family history of diabetes. Type 2 diabetes patients still produce insulin, but the body does not recognize it, and this fails to utilize it. It is also known as adult onset diabetes. Type 2 diabetes is no longer exclusive among people over 40 years of age. Doctors now find this disease in teenagers and young adults. What used to be the disease of our grandparents is now a disease of youth too. How could one say that he or she might possibly have diabetes? The most common symptoms of diabetes are frequent urination, feeling very thirsty, and hunger. Other symptoms include blurred vision and numbness of feet and hands. These usually indicate that kidney, eye, and nerve damage has already begun. Diabetes is the leading cause of complications. High blood sugar can trigger clogging of small vessels and hardening of arteries that could result to heart disease. Circulatory disorders caused by diabetes can even result to amputations. Care for the disease requires a lot of hard work, which includes proper diet, daily exercise, oral medications, regular blood testings, and sometimes insulin. Particularly among type 1 diabetes patients, insulin is the number one medication. Insulin comes in a liquid form and must be injected into the body through the use of needle. It is injected into the layer of fat beneath the skin. Since food affects how much glucose is in the blood, proper nutrition is crucial to managing diabetes. They should watch out their intake of sugars and refined carbohydrates. Remember the old saying, prevention is still the best remedy. Think of that when it comes to diabetes mellitus. Prevention of diabetes can be described in two words, lifestyle changes. Recent study shows that lifestyle changes can prevent the onset of type 2 diabetes, especially to those who are at high risk. Exercise and weight loss can reduce the onset of type 2 diabetes by 58%. Eating more fruits, vegetables, and whole grains, particularly oats, beans, and legumes. Also, eating fewer processed meats and other animals can reduce diabetes as well. Diabetes is a disease that festers both the young and old adults. Diabetes is an epidemic that affects 24 million people in the United States, who must take steps to prevent harmful complications. With the increasing occurrence of diabetes, I have given you a better understanding of a disease that can be fatal or that can be prevented and controlled.